Lip lifts are all the rage, so let's get the story straight on what a lip lift is, if you're the right candidate for it, and if it's something you might be interested in. So a lip lift is not Botox, it's not filler, it is a minor surgical procedure where we take skin from underneath the nose and shorten the distance between the underside of the nose and the top of the lip to give you a fuller looking lip, but more so to shorten the distance between the nose and the lip. So it started mostly as patients got older. This distance tends to lengthen. So this lengthens right here, which throws off the proportion and balance of the face because usually these are generally in proportion, these three areas. And as this gets longer, it makes the face look longer. So a lip lift tends to complement the lower third of the face by making it look a little more harmonious. As a nice added benefit, if you're a right candidate for this procedure, by shortening that lip, you also get more turnout of your top lip, meaning you get more of this. Because as we shorten the skin or shorten the distance and take the skin out, your top lip is going to turn out a bit more. But the thing to remember is that although this procedure is relatively minor, has very little downtime, there are risks associated with it. So the best candidates are those that understand a few key things. One is that the primary goal is to shorten the distance between the nose and the lip. That's the main thing that you're going to get as a benefit of it. Two is that I don't know how much of your top lip is going to show. We are doing some research on that, but at this point, we're not actually sure that if you take 1 millimeter of skin here, that you're going to get 1 more millimeter of lip show. The other thing is that you will have a scar. There's no way to not have a scar, but the degree to which that scar is noticeable varies so widely. I have patients that are a month from surgery, 2 months from surgery, and you would never see a scar there. I've had patients a year out from surgery and you can still sort of see a scar, and it might need some enhancements or touch-ups with either a laser or a steroid injection. But remember, we have lots of tools in our tool belt to make the scar look much smoother and not noticeable. So that procedure is generally done in the office unless you're doing something else. It's done under local anesthesia, so all you need is an injection of numbing medication and the whole thing can be done while you're awake. We take skin out from under the nose and we do some small modifications to make it look a lot more natural, to give you more lip turnout, and to make the scar look not noticeable. The stitches are in for about 5 to 7 days. I generally tend to take them out a little bit earlier. And then we take care of the scar with sunscreen, scar gel, and any other treatments down the line that might make the scar look better. Like I said, lasers or microneedling or something like a steroid injection. These will improve the quality of that scar as you're healing. So scarring, that's everyone's biggest concern, and it is something we stress all the time with these lip lifts because again, the scar is right in the middle of your face. So once the stitches come out, the scar actually looks pretty good. You might have a little redness there, but in general, it can be covered up with makeup if you wear makeup. But at about the 3rd week, and I tell everybody this, remember week 3, because if I don't tell you this, you're gonna freak out. The scar will thicken. I repeat, the scar will thicken because your body has to heal it enough to then back away from it and have the scar mature for it to look better. So your scar will thicken at week 3, and then it will go down from there. At a year, your scar is about 80% of the strength that it was as normal skin, and it will look pretty much how it will look for the rest of your life, short of maybe it getting a little bit lighter. But scars tend to mature over the course of about a year. Some people a little faster, some people a little longer. But remember, there's things that we can do in the office and that you can do at home, like massage, sunscreen, silicone-based scar gels. There are things that you can do to make that scar heal really, really, really well and to be less noticeable to the naked eye. Another good reason for getting something like this done is if you have a long upper lip and you get fillers done, that combination to me doesn't really exist in nature. There are 3 types of people that I think exist in this world. One are people with long upper lips and thin lips, though then there's people with short upper lips and full lips. And then there's the unnatural one, which is some strange combination of the two. And those are the ones to me that you can tell have had something done like lip filler. If you have a very long upper lip and your lips have been thinned out because of that, and you put filler in there, those people are just very obviously done from a cosmetic perspective. So I think lip lifts, even though they're a surgical procedure, tend to look a lot more natural. If you're interested in fillers or something for your lips like a lip flip, give us a call. Our office would love to see you in consultation, and we look forward to seeing you.